Hello, everyone. Today we will be talking about CPT modifiers. My name is Cynthia Bennett, and I will be your facilitator for this session. So we're going to go ahead and get started and talk a little bit about modifiers. So what I'm going to do now is I'm going to share a PowerPoint with you that further discusses modifiers. And you should be able to see my screen now. So modifiers are basically two digits that you're going to append onto your CPT code. It indicates that there is some type of change done to that code. So basically, when you read the description of that code, the description is going to remain the same. So it's not so much that the description of the code is going to change. So the main definition is not changed. It gives additional information when necessary, and it ensures that your claim will be paid correctly. So when the insurance company pulls your claim, they'll know that something is different about the claim because you have the modifier on there. And so depending on what modifier you add, it's going to determine what has actually changed. So there's two types of modifiers. You have your level 1 modifiers, which is with your CPT, which is a 2-digit numeric modifier, which is found in Appendix A of your CPT manual. So if you guys, I always suggest this, get familiar with your manuals, use it, put your tabs in there so that you're able to get to each of the sections of the coding manual rather quickly. So again, you're going to find those modifiers in Appendix A. You also have what's called level 2 modifiers, and these modifiers are going to be found in your HCPCS manual. Those are going to be 2 digits, and those are going to be alphanumeric. So those will be alphanumeric codes. They're found in your HCPCS in the appendix as well. So as you guys will notice that most of the coding manuals are kind of set up the same. You're going to have your appendixes, you'll have your indexes, and you'll have your area where the codes are actually listed. So again, most of your books are going to be set up in the same manner. So why use modifiers? So here are some examples of when you're going to use a modifier. So when a service or procedure has both a technical and a professional component, this will normally happen with your radiology procedures. Also, if there's more than one physician, there are times when more than one physician can see that patient. So surgery is a great example of when you may have more than one. It's been performed in more than one location. So you want to let the insurance company know that that procedure was performed in more than just a one location. Another reason why you want to use a modifier is taking longer amount of time than it normally would take. So you're going to let the insurance company know, I did this procedure, but it took a little bit longer. And so how you let them know is by providing that modifier. Same thing if the procedure has been reduced. So what will happen is sometimes a patient may come in, for example, for a colonoscopy. The patient is prepped, they're prepared, they're coming in for the colonoscopy, but for some reason on the date of that exam and they're ready to go in, the doctor just says, you know what, I see something, I don't want to take the chance and go in, but the patient has already received their anesthesia and they're already prepped and ready to go, but the doctor decides not to go forward with it. This is an example of when you're going to apply that modifier. So you'll still get paid a partial payment for that service. It just won't be the full amount. Another time you want to use a modifier is when the procedure has been performed multiple times. This is another time where you're going to use that modifier to say, insurance company, yes, I did this. This is not a duplicate. I did this same procedure more than once. So this is another great opportunity where you're going to use those modifiers. Another time you're going to use it is when only part of the procedure was completed. So for some reason, maybe they were not able to complete that procedure. So we're just letting the insurance company know that we weren't able to finish it, but we're still eligible for part of the payment. Another one is when you have a bilateral procedure, meaning that procedure was done, let's say, on the right arm and the left arm. So that will be considered a bilateral procedure. So you'll put that modifier on there to let the insurance company know. When an unusual event occurs during the procedure, so something that's very unusual that normally never occurs, we want to let that insurance company know that something was different. Another time would be when accompanying or an adjunctive procedure was also performed. So when there's more than another procedure performed within one, let's say, operation, one surgery, we want to let the insurance company know that there was something additional that was done. So the use of modifiers are mainly used with your physician services. So with your office visits, with any type of procedure or minor procedure that the patient may get either in the office or in the ambulatory care center. And then the other places in the ambulatory care center. And then this is normally like a surgery suite. It's going to be outpatient hospital. So it's not an inpatient setting. You can actually use the modifiers for those as well. So that's going to be it for this particular video. We'll get into the modifiers and start identifying them and then talk about how they're being used in our next video. Thank you for joining.